And we're back with you, dear viewers, from all over the international to here in Kuwait. We are having to us today with honor Dr. Abdulhamid Hamid, and he is a board certified in physical medicine and rehabilitation. He is also having specialty in chronic pain medicine from the University of Toronto in Canada, and he is considered an international expert in his field because he has been practicing in different regions across the globe. So he's a traveler and a good traveler, this is what I can say. Dr. Abdulhamid helped thousands of patients to live a better quality of life. So how about we welcome him together and ask our questions. Hello and good morning, Doctor.
Hello, good morning. Thank you for having me.
It is wonderful to have you, Dr. Abdulhamid, and I know you are a traveler, right?
I am.
Yeah,
right.
As you are going here and there all over the globe, this practice, let me say for first, it's something in the past you used to be called masseuse, right? This is the old history of physical therapy and rehabilitation.
Yeah.
But nowadays it is some kind of its own medicine.
Absolutely.
Tell us about this, please.
Absolutely. So, I mean, when you mentioned about like physical therapy is a very old medical specialty or health. It's not a medical, it's a health specialty,
yes,
and has been going for years or maybe thousands, starting with massage, and then physical modalities were added on a scientific basis.
Yes.
However, when it comes to the physical medicine and rehabilitation, it's like a branch of medicine, and it's a recognized specialty. Yes. Started by 1945 after the World War II in the United States.
Yeah, this is what I were talking about, because it's,
yeah.
If we are going back to the medicine history, it's a new set or a new branch of medicine. It is old, but it has been recognized as a clear medicine since the 40s, right?
Right.
So how do you really see this medicine? And as we introduced you in the beginning, you were talking about that traveling around the globe, and you have been doing all branches, and you have tackled a little bit here and there. Talk to us about it.
Yeah, I mean, there are some differences while approaching this specialty all over the world. Like in the region, in the Arab region, when it goes to Europe and North America, like Canada, there is like a huge discrepancy between the practices. Either like in terms in number of physicians, like physical medicine and rehab,
yes,
which we call physiatrists, the ratio between the number of population and the number of physiatrists.
How about the diseases, the chronic diseases, the chronic illnesses, or the complaint? Does it differ from the Arab Peninsula to Europe to, let's say, the northern of the America?
Yeah, I would say, for my surprise, there is a difference. You know, there is a difference, especially with the suffering of the problems. What I have been seeing in Canada, like people suffering a lot from the same problem. In this region, people suffer less. For some reason, it's unexplained for me up until now. I'm trying to dig deeper to find why there are like less suffering from the problems. So that's really an issue, especially in the chronic pain subject. I have, you know, thinking about why people here in this area not having that deep suffering from this kind of chronic issues compared to Canada.
Well, I think maybe the weather is here different than the Canada. There's so much cold in there, and this is a little bit of heat. So I think our joints and our bodies really accumulate itself to that, right?
That might be a reason, because there are some like scientific evidence that the cold weather really increases the feeling of pain, because it's lowered down the threshold of pain. So there are some evidence, might be some reason, with other like social, ethical, cultural reasons behind that. And again, the system itself, it plays a role in the suffering and the lingering of the suffering.
Okay, so about the pain expectation, Doctor, I know there is here in Kuwait a pain clinic, pain-free clinics or something like that, and this is what, when I was searching, I have seen so many pain relief clinics, especially in El Sabah area, and they are trying to help people deal with those chronic pains, to help them make a little bit of a relief from time to time. So tell us about those pain reliefs or pain procedures, if we can say about that?
I mean, when we are talking about like pain medicine or pain management, there are like different approaches or different procedures.
Okay.
One of them, the interventional procedure, is like giving injections,
Yes.
either corticosteroids, lidocaine, or Botox, or other like medication to help relieve the pain.
Okay.
However, with the chronic cases, the best approach is to have a multimodal approach. It's not only about injection or a pill and then send the patient home. It's like a better approach to have like addressing all the underlying problem with the patient.
So tell us a little bit about those procedures together, and how would Dr. Abdulhamid deal with them?
Yeah, that's a point. Importantly, you know, as I said, we are talking about chronic cases, chronic pain, which is any pain that lasts more than 3 months by definition.
Yes.
Then with that pain and suffering, a lot of things come up.
Okay.
So including sleep problem, mental issues, social withdrawal, and so on.
Yes.
So given that, you know, the best result can be achieved only by addressing all those factors and elements efficiently.
Okay.
So we need to take care of all of that. It's not about only medication, movement, mental health, sleep, and so on.
So you tackle a lot of different specialities or branches, including the psychiatrist, right?
Absolutely, we collaborate with the psychiatrist. If there is like a deep problem, then we refer our patient to a psychiatrist to put a diagnosis, and to psychologists to help them like support, getting some psychological support.
Okay.
Yeah.
This is really great, because we can see on the screen that a lot of people, they have a lot of those intervention. Now, if we are talking about the new medicines, the new injections like Botox and all of that, how does it really interfere with the chronic pains?
Yeah, I mean, it does. It's something not very recent, but still recent compared to other medicines. You know, Botox in general, as you know, it's very well known in the aesthetic and cosmetic issue.
For women especially.
Although it's not the first like indication to use the Botox, which is a kind of toxin produced by a bacteria.
Okay.
So initially it was introduced by an ophthalmologist to manage like a spasm around the eye that affects the vision.
Yes.
Later on, we start to use it for different indications, like in rehabilitation when somebody has a muscle spasm, or we call it spasticity. We inject the muscle with the Botox, then it relaxes the muscle and enable the person to use their limbs, arms, legs like more properly. Later on, we recognize that there is additional benefit of this Botox by eliminating or reducing the pain. And studies start to go through. And for the time being now, we have at least like 3 areas where we can use the Botox to manage pain.
Okay.
One of them, intra-articular. This is very, there is an evidence behind that.
Really?
I mean, and it's not very common. Usually people know about, you know, injecting steroid or cortisone in the knees.
Yes.
But injecting Botox is very, very helpful and a safe procedure, and it helps patients to tackle the pain. Another area is the muscle pains.
Yes.
When there is a myofascial pain with small nodules in the muscles, also by injecting those nodules, we relaxes the muscle and enable the patient to live like with less pain. And the third one is about migraine, chronic migraine. You know, for chronic migraine, there is a protocol based on a multi-center, multinational study, which shows that injecting Botox in a certain area, we have like 31 points, we inject the patient, and it gives like relief for like almost 3 months.
Wow.
Sometimes it's more depending on the case.
That's great, because
Absolutely.
I can firsthand relate to the migraine chronic pain. It's a severe pain, and 3 months of pain relief by just injection Botox. It would be a great benefit for the patients.
It is because, as you mentioned, I mean, chronic migraines is a debilitating, it's a disabling issue for patients. They can't function very well.
Exactly.
And they usually consume a lot of medications with all side effects you know about it.
Exactly.
So with this injection, some of the patient will be able to stop the medication altogether.
Okay.
Some of them can reduce it to a minimum level only on like certain days, but overall results are really very encouraging.
That is encouraging. As you said, Doctor, for the patients and for the chronic pain people, you have a lot of safe, let's say, alternatives to go on. And if you want to know more about those safe injection substances beside Botox, you said there are some new substances, right, or some new medications for that as well? For the chronic pain relief.
Yeah, chronic pain medication, you know, there are like medication. Yes. I wouldn't say there are a lot of new medication, because the new approach is to refrain from taking a lot of medication, especially the analgesics. Because analgesics would help in the acute pain. When somebody hurts their hand, like twisted their ankle, fall down, all of that, medication, analgesics would help.
If we can say, if athletes would help them there in this kind of medication?
Yeah, it does, especially if it's like for a short period of time.
Yes.
But when it comes to the chronic situation, chronic pain, those analgesics wouldn't help. Because there are a lot of underlying changes in the nervous system. And those type of traditional medication don't tackle the changes in the nervous system. So when we use medication with the chronic pain, we use like a different groups of medication, which to affect, you know, the nervous system changes or central sensitization.
Does it differ in age when someone is like growing, and how do you treat people like in old ages? We know that the chronic pain is like a life matter. Sometimes it would go together hand by hand for a long period of time, years, if we can say that. So does it differ when they are a little bit of getting older by the time?
Yeah, indeed, that's really a very good question, because, you know, pain has to do with the inflammation, and the inflammation increases while we age. It shouldn't, but this is the current situation. And the pain complaints in the elderly population is more common than others. On the other side, it's like very difficult to start them on different medication, because their bodies, their metabolism is like different, and their ability to react to the side effects of medication is not like as they were young. So we have to be very careful when we are addressing pain in adult people, in elderly people, and to use the medication minimally. Try to use non-pharmacological therapies like modalities, heat, sometimes electricity, and massage therapy, topical creams, rather than starting them on medication with all and long list of side effects.
This is because we are always thinking about our parents and those elderly people who we really would love to help. So how does the social media really help people to understand such going medical problems and etc.?
I mean, as you know, like social media is like part of our lives.
Yes,
it's
exactly.
The virtual other lives.
The media it started to be one of us.
Yeah, it is. So we can't say it's good or bad. It's how we use it.
Yes.
And the good thing, it gives access to everyone to go and search for what they want to see, to read or to see, or to what they are looking for. At the same time, it gives everybody the liberty to say whatever they want to say. And from my notice when I'm searching or surfing the social media, I can see a lot of misinformation provided by people who has no experience, no qualifications. All what they need just to attract people, to get more fans and followers, and they really provide sometimes like wrong information.
False information.
Yeah, false information. At the same time, there are like good accounts we can rely on. So we have to be very skeptical when we are taking some information from the social media, especially when we want to implement something in our treatment. We can get some ideas, then we discuss it with our healthcare professional, either the doctor, pharmacist, physical therapist, then to see what they say about it before start doing any changes in our treatment plans.
Exactly. As you said it, Doctor, and put it right, we need to search, we need to look for ourselves, we need to think before we just listen to others, whoever are saying whatever, on those social media. That's a great advice. Do you have much more? One big more advice for our viewers as well?
You know, the field of pain management is really something new, especially in this area. The concepts, understanding of the problem, even among healthcare professionals, is still in the beginning.
Okay.
But I would say, you know, now when we are thinking about pain, start to think not about pills. Not only pain means, okay, give me a painkillers.
Yes.
So start thinking about something different.
Okay.
Some non-pharmacological treatment, some, you know, psychological or mental health relaxation techniques, rather than jumping to take a pill, especially in the chronic cases that will affect their bodies negatively.
In the future, especially while we're growing.
Yeah.
Because those medication will not help us on the long term. I know that for a fact. In the past, we used to have one capsules of the, let's say, Panadol, if we can say, or the, but now we don't really get enough of 4. It will not do, and that is because we are consuming those painkillers as we consume water.
Unfortunately, sometimes it happens. You know, that's maybe one of the most important messages I would like people to get. And the other one is about, you know, when we are dealing with chronic pain cases, like I said before, the multimodal approach is the best to achieve results in some medication, exercises or movement, as well as the mental health.
Yes, exactly. Thank you very much, Dr. Abdulhamid, for giving us such a glimpse in this wonderful field. Because, you know, dear viewers, if you are suffering from pain, and as Dr. Abdulhamid said it first, in the northern areas of the Canada, the people will say, I have a pain. Here, we don't show it much, maybe because we don't like to be feeling we are in pain. We're strong, we're machos, we can do everything. But how to treat that, how to go around it, and how to really achieve a pain relief life is all about the approach. So go to the right doctors, go to the right physicians and experts, and don't listen too much to the social media. Look for yourself. Thank you very much, Dr. Abdulhamid, for being here with us and for joining us and answering all of our questions.
Thank you so much. Have a pleasant day.
Thank you.